following content is for educational purposes only. We are not medical professionals or health advisors. The information shared comes from various medical experts worldwide. For professional advice, please consult a qualified healthcare provider. Thank you for being part of our community. According to medical doctors, hospice nurses, and medical journals around the world, chronic obstructive pulmonary disease, COPD, is a progressive respiratory condition that significantly impairs lung function, leading to increasing breathlessness and a decline in quality of life. As the disease advances, patients often face numerous challenges, especially during the end stages. Hospice care plays a crucial role in providing comfort and support to these individuals, addressing both physical and emotional difficulties. Insights from hospice doctors and nurses have shed light on the most formidable challenges encountered by patients with end-stage COPD. One of the most challenging aspects of dying from COPD is the unpredictable nature of the disease's progression. Unlike some terminal illnesses that follow a relatively predictable decline, COPD patients often experience long periods of stability, punctuated by sudden, severe exacerbations that can rapidly worsen their condition. This makes it difficult for patients, families, and even healthcare providers to determine when end-of-life planning should begin. Dr. David Currow, a palliative care specialist, explains that COPD does not have a clear-cut trajectory like cancer or advanced heart disease. Patients may go through multiple hospitalizations for exacerbations, recover slightly, and then decline again, making it hard to predict when a patient is truly approaching the final stage of the disease. Families often experience emotional whiplash, thinking their loved one is improving, only to face another sudden crisis. This unpredictability creates challenges in decision-making. Many COPD patients and their families struggle with knowing when to transition to hospice care. Unlike cancer patients, who often have a more defined timeline for when curative treatment is no longer effective, COPD patients and their doctors may not recognize that they are in the final months of life. As a result, many COPD patients enter hospice care too late, missing out on valuable end-of-life support that could have provided comfort and dignity in their final days. Laura Martinez, a hospice nurse who has extensive experience caring for patients at the end of life, recalls a patient, Mr. Henry, who had lived with COPD for over a decade. His family had difficulty accepting that his condition was terminal because he had survived multiple severe flare-ups in the past. Each time he was hospitalized, he would recover just enough to return home, leading his loved ones to believe he was getting better. However, one day, he was suddenly unable to breathe properly, and within hours, he passed away unexpectedly. His family was left in shock, unprepared for the finality of his condition. Had they been more aware of COPD's unpredictable decline, they might have sought hospice care earlier to ensure a more peaceful transition. Julie McFadden, a hospice nurse with extensive experience caring for patients at the end of life, particularly those suffering from chronic illnesses such as COPD, provides valuable insights into end-of-life care. According to her, in one of her educational videos on this subject, she said, and I quote, "I frequently encounters patients and families who are uncertain about what to expect in the final stages of this disease." She explains that COPD, or chronic obstructive pulmonary disease, is a progressive lung condition that significantly impacts quality of life, especially in its later stages. One of the most common fears among those with COPD is the sensation of suffocating at the end of life. However, Nurse Julie assures that hospice care is highly effective in managing this symptom. While patients may experience intermittent episodes of increased shortness of breath, these symptoms can be controlled. The disease follows a pattern of decline, with patients experiencing periods of stability followed by sudden worsening, often triggered by infections or natural disease progression. She further stated that, as the disease advances, individuals often become oxygen dependent, relying on portable oxygen machines and significantly reducing their mobility. Daily activities become increasingly challenging, and independence is gradually lost. This loss of independence can be one of the hardest aspects of the disease, as it limits a person's ability to go about their life as they once did. To improve quality of life, education and preparation are key, she said. Those who accept the changes in their condition, seek support, and make necessary lifestyle adjustments tend to cope better. She advised that accepting assistance, moving to a more accessible living space, and adapting to new mobility limitations can significantly improve well-being. Hospice care plays a crucial role in managing COPD symptoms, primarily by addressing shortness of breath. Common treatments include oxygen therapy, nebulizers with medications such as albuterol and ipratropium, liquid morphine to relax the diaphragm and ease the sensation of breathlessness, and steroids to reduce inflammation and improve energy levels. Each patient's treatment plan is tailored to their specific needs, ensuring comfort and symptom control. For caregivers, it is important to understand that COPD patients will have both good and bad days. On difficult days, strategies such as using a fan, keeping the patient calm, administering prescribed medications, and seeking hospice support can provide relief. Caregivers must also prepare for the increasing level of assistance their loved one will require over time. In the final stages of COPD, patients will naturally begin to sleep more, eat and drink less, and experience worsening shortness of breath. Hospice care ensures they remain comfortable through appropriate medication management. Most individuals do not experience distress in their final moments, as sedation is often used to alleviate discomfort and breathlessness. For those wondering whether hospice is appropriate for them or a loved one, hospice nurses and doctors encourages speaking with a doctor or directly contacting a hospice provider to assess eligibility. Early involvement with hospice can significantly improve quality of life in the final months, ensuring that patients are as comfortable as possible. Another issue with COPD's unpredictable trajectory is that it can lead to fear and anxiety in patients. Many individuals with COPD live in constant uncertainty, never knowing when the next exacerbation might occur. Dr. Emily Brigham, a pulmonologist, notes that this lingering fear can be more distressing than the physical symptoms themselves. Some patients feel like they are living with a ticking time bomb, worrying about whether the next breathless episode will be the one that sends them to the hospital or signals the end. This uncertainty can also cause caregiver burnout. Families may struggle with providing round-the-clock care, unsure if their loved one will need immediate medical attention or if they are stable enough to continue managing at home. The unpredictability of COPD means caregivers must be constantly vigilant, leading to emotional exhaustion and stress. To address these challenges, hospice teams focus on educating families about COPD's progression, encouraging discussions about advanced care planning, and providing emotional support to reduce anxiety and uncertainty. Dr. Susan Black, a palliative care physician, advises patients and families to have early conversations about end-of-life wishes, even if the patient appears stable. She stresses that making these decisions ahead of time can reduce the emotional burden later on, allowing patients to focus on comfort rather than emergency medical interventions. Understanding and preparing for the unpredictable trajectory of COPD can make a significant difference in the final stages of life. While the disease may not follow a straight path, having a plan in place can help ensure that the patient receives the best possible care and that their family is emotionally prepared for what is to come. One of the most distressing and difficult challenges for individuals dying from COPD is severe dyspnea, or persistent shortness of breath. As the disease progresses, the lungs become increasingly damaged, making it harder for the patient to inhale and exhale effectively. This leads to a sensation of air hunger, suffocation, and a constant struggle for breath, which can be terrifying for the patient and emotionally overwhelming for loved ones. Dr. Kathleen Puntillo, a critical care and palliative expert, describes end-stage COPD dyspnea as one of the most severe forms of breathlessness experienced in medicine. Unlike the breathlessness someone feels after intense exercise, COPD patients feel as if they are suffocating even while at rest. This continuous sensation of not getting enough air leads to panic, anxiety, and extreme exhaustion. Many patients describe it as feeling like they are drowning in slow motion, unable to find relief no matter how hard they try to breathe. Nurse practitioner Jane Smith emphasizes that severe dyspnea often leads to extreme fear and distress, which can make the sensation even worse. When a patient panics due to difficulty breathing, their heart rate increases. They begin to hyperventilate, and their oxygen levels drop even further, creating a dangerous cycle. In hospice care, one of the biggest goals is to break this cycle by managing breathlessness effectively. As COPD worsens, simple tasks such as walking across the room, bathing, or even sitting up in bed become exhausting. Some patients describe feeling out of breath just from talking or eating. Many COPD patients struggle to lie flat because fluid builds up in the lungs, making it even harder to breathe. As a result, they must sleep propped up in chairs or with multiple pillows, leading to poor sleep quality and extreme fatigue. Since breathing takes so much energy, many COPD patients feel too exhausted to eat, leading to malnutrition and muscle loss. Dr. Emily Brigham explains that eating becomes physically demanding since the diaphragm has to work harder while digesting food, making the patient feel even more breathless. One of the most difficult realities for people dying from COPD is the cycle of frequent hospitalizations. As the disease progresses, exacerbations become more severe and occur more often, requiring emergency medical care. Each hospitalization further weakens the body, making recovery more difficult and increasing the likelihood of another hospitalization soon after. Dr. Emily also explains that COPD hospitalizations often happen unexpectedly. A patient may seem stable for weeks or even months, only to be rushed to the hospital due to a sudden worsening of symptoms. These flare-ups can be triggered by respiratory infections, environmental factors, or simply the natural progression of the disease. Unlike conditions with predictable declines, COPD patients and their families are often caught off guard by these sudden health crises. COPD-related hospitalizations can also be physically traumatic for patients. Being admitted often means undergoing aggressive medical interventions, such as mechanical ventilation, high-dose steroids, and repeated use of antibiotics. While these treatments can temporarily improve breathing, they weaken the immune system, damage muscles, and contribute to long-term complications. Dr. David Currow, in one of his lessons, notes that each hospitalization leads to a gradual decline in overall health. Patients often return home weaker than before, unable to perform basic tasks they previously managed. Some lose their ability to walk short distances, dress themselves, or even eat without assistance. This loss of independence can be devastating, leading to frustration, depression, and a sense of helplessness. Hospice nurse Jane Smith recalls the heartbreaking story of Mrs. Whitman, an 82-year-old woman who had been living independently before a severe COPD flare-up led to hospitalization. After spending 2 weeks in the ICU, she was discharged but could no longer walk to the bathroom without extreme exhaustion. She had gone into the hospital hoping for relief, but returned home unable to care for herself. Her family struggled with guilt, wondering if the hospital stays were truly helping or if they were only prolonging her suffering. Frequent hospitalizations also place a significant burden on family caregivers. Many patients rely on their spouses, children, or other loved ones to coordinate emergency care, stay with them in the hospital, and manage their medical needs at home. The emotional and physical toll on caregivers is immense, as they are constantly on high alert, fearing another crisis. Financial strain is another major consequence of repeated hospitalizations. Even with insurance, COPD patients and their families often face mounting medical bills, transportation costs, and lost income due to time spent in hospitals. Dr. Alan Thompson, a healthcare economist, highlights that COPD hospitalizations are among the most expensive for chronic disease patients, especially when intensive care or long-term rehabilitation is required. Many families struggle with balancing financial concerns while trying to provide the best care for their loved one. Perhaps the most difficult aspect of frequent hospitalizations is the lack of closure and peace for COPD patients nearing the end of life. Unlike diseases where patients gradually transition to comfort care, many COPD patients spend their final months cycling between home, hospital, and rehab centers, unable to settle into a peaceful routine. The unpredictability of hospital stays makes it hard for both patients and families to process the reality of their condition. For individuals dying from COPD, the psychological toll can be just as devastating as the physical symptoms. Anxiety, depression, fear, and frustration are common emotions that intensify as the disease progresses, making the final stage of life incredibly difficult. The constant struggle to breathe, the loss of independence, and the uncertainty of when the next medical crisis will occur can create a deep emotional burden that affects both patients and their loved ones. Dr. Margaret Campbell, a palliative care specialist, further explains that the sensation of breathlessness is closely linked to feelings of panic and anxiety. The brain instinctively interprets difficulty breathing as an emergency, triggering the body's fight-or-flight response. For COPD patients, this response happens repeatedly, leading to chronic anxiety that never fully goes away. Many patients describe feeling trapped in their own bodies, constantly fearing the next breathless episode. Nurse practitioner Laura Martinez also recalls working with Mr. Davis, a 76-year-old COPD patient who had once been an active and independent man. As his disease progressed, he became unable to leave his home without experiencing severe breathlessness and exhaustion. Over time, he withdrew from social interactions, stopped attending family gatherings, and became increasingly depressed. He confided in his hospice nurse that he felt like a burden to his family and no longer saw a purpose in living. Depression is particularly common but often overlooked in COPD patients. Dr. David Currow, a palliative care researcher, found that up to 40% of patients with advanced COPD suffer from clinical depression, yet many do not receive proper psychological support. Unlike patients with diseases like cancer, who often receive emotional counseling and palliative care earlier in their illness, COPD patients frequently struggle in silence. Their condition worsens gradually, making it harder to pinpoint when they truly need emotional support. Another significant source of psychological distress is the loss of control over daily life. COPD patients often go from being independent individuals to relying on others for even the simplest tasks. The inability to walk short distances, dress without assistance, or even talk without becoming breathless leads to frustration, embarrassment, and feelings of helplessness. Many patients experience anger toward their bodies, resentment toward their circumstances, and guilt for needing so much help. Family members often witness these emotional struggles but feel powerless to help. Mrs. Thompson, the wife of a COPD patient, recalled how difficult it was to watch her husband cry out of frustration. He had once been the provider for their family, but by the end of his illness, he felt like he had lost his dignity. His children avoided talking about his struggles, afraid of making him feel worse. Emotional isolation only deepened his depression, making his final months even harder. Fear of dying is another major psychological challenge for COPD patients. Many worry not just about death itself, but about how they will die. The experience of severe breathlessness makes patients terrified that their final moments will be filled with suffocation and panic. Dr. Emily Brigham explains that this fear can lead to frequent panic attacks, nightmares, and severe insomnia. Patients often wake up gasping for air, unsure if they're experiencing a real medical crisis or another anxiety episode. This ongoing stress weakens the body even further, making it even harder to manage the disease. Another difficulty is emotional distress related to unfinished business. Many COPD patients reach the end of life with regrets, unresolved conflicts, and unfulfilled dreams. Some regret not taking better care of their health earlier in life, while others feel guilty for things they did or did not do for their families. The knowledge that time is running out adds to a sense of urgency, yet many are too weak or too overwhelmed to address these lingering concerns. Hospice nurses often observe how these emotional struggles manifest in unexpected ways. Some patients become withdrawn and refuse to talk, while others lash out in frustration, arguing with loved ones over small matters. Anger, sadness, and mood swings are common, but can be confusing for family members who don't realize that these behaviors are symptoms of deeper emotional pain. One of the hardest aspects of psychological distress in COPD is that it is often underestimated by doctors and caregivers. Because the disease is viewed primarily as a respiratory condition, its emotional and mental impact is sometimes overlooked. Many COPD patients suffer silently, feeling that their fear, sadness, and frustration are not fully understood by those around them. The final stage of COPD is not just a battle of the body, it is a battle of the mind and spirit. The combination of fear, depression, anxiety, and regret can be overwhelming, making the dying process incredibly challenging for both patients and their families. One of the most difficult realities for people dying from COPD is social isolation. As the disease progresses, patients often withdraw from family, friends, and social activities due to physical limitations, embarrassment over their condition, and exhaustion. The inability to participate in conversations without becoming breathless, the struggle to leave the house, and the emotional toll of feeling like a burden cause many patients to suffer in silence. Dr. Sarah Booth, a palliative care physician specializing in respiratory illnesses, explains that COPD patients experience higher rates of isolation compared to those with other terminal illnesses. While diseases like cancer often receive strong social and emotional support, COPD patients tend to be less visible in the public conversation about chronic illness. Many of them become forgotten in their suffering, leading to deep loneliness. Nurse practitioner Michael Grant recalls one of his patients, Mr. Ellison, a 74-year-old man with end-stage COPD. He had once been the center of family gatherings, known for his jokes and storytelling, but as his disease worsened, he could no longer talk without gasping for breath. He stopped attending events, avoided phone calls, and even refused visits from friends because he didn't want them to see him struggling. By the time he entered hospice, he admitted that he had spent most of his final year completely alone, even though his family still cared deeply for him. COPD patients often become housebound due to their declining health. Even short trips outside can be exhausting, and many feel that it's simply too much effort to engage in activities they once loved. Dr. David Currow, a palliative care specialist, describes COPD as a disease that shrinks a person's world, turning what was once a full life into a series of lonely, disconnected days spent indoors. Another major factor contributing to isolation is the stigma associated with COPD. Many people with the disease, especially those who smoked earlier in life, experience judgment and shame from others. They often hear comments like, "You should have taken better care of yourself," or "You did this to yourself," making them feel unworthy of compassion and support. Dr. Susan Black, a hospice physician, has seen patients refuse visitors because they are tired of hearing unsympathetic or dismissive remarks about their illness. Caregivers and family members often struggle to balance their own lives with providing support to someone with COPD. Unlike diseases with a predictable decline, COPD patients can remain in a fragile but not immediately terminal state for months or even years. This long period of illness can lead to caregiver fatigue, where family members unintentionally pull away due to exhaustion and stress. Mrs. Daniels, the daughter of a COPD patient, described how guilty she felt for not visiting her mother more often. She loved her mother deeply, but found it emotionally difficult to see her suffering. "Every time I saw her, she seemed weaker, sadder, and more tired. I didn't know what to say anymore, and I didn't want to make her feel worse." This silent emotional distance, though unintentional, can leave COPD patients feeling abandoned. Another overlooked aspect of COPD-related isolation is the inability to communicate freely. Many patients can't hold long conversations without running out of breath, making even simple phone calls exhausting. They may want to stay connected, but physically struggle to engage in meaningful discussions. As social connections fade, many COPD patients become deeply depressed. Dr. Emily Brigham further notes that social withdrawal leads to emotional distress, worsening both physical and mental health outcomes. Without regular social interaction, patients lose the motivation to keep fighting, leading to faster decline. The combination of physical exhaustion, limited mobility, stigma, and emotional withdrawal makes social isolation one of the most difficult experiences for COPD patients. It not only robs them of companionship, but also intensifies their emotional suffering, making the journey toward the end of life even more challenging. One of the most overlooked but devastating difficulties for people dying from COPD is severe nutritional challenges. As the disease progresses, eating becomes increasingly difficult, leading to rapid weight loss, malnutrition, and muscle wasting. Many patients lose their appetite, struggle to chew and swallow, or feel too breathless to eat, making mealtime a physically exhausting and emotionally draining experience. Dr. Robert Miller, a pulmonologist specializing in COPD, explains that patients with severe lung disease burn significantly more calories just by breathing than healthy individuals. Because their lungs have to work harder to inhale and exhale. They require up to 50% more energy than a person without COPD, yet they often lack the strength or appetite to consume enough calories. This results in rapid, unintentional weight loss, which further weakens the body and makes breathing even harder. Hospice nurse Sarah Whitman recalls a patient, Mr. Donnelly, who had always been a strong man but lost over 40 pounds in his final months. His wife, desperate to keep him nourished, would prepare his favorite meals, but he could barely manage a few bites before gasping for air and giving up. He eventually told his family that eating felt like trying to run while holding his breath, making every meal a frustrating and painful experience. COPD patients often describe a feeling of fullness after just a few bites. This is because the diaphragm, the muscle responsible for breathing, is weakened and compressed by overinflated lungs, leaving less room for the stomach to expand. Many patients feel bloated or nauseous after eating, further discouraging them from consuming enough nutrients. Another major difficulty is fatigue and exhaustion. Many patients lack the energy to prepare meals, chew, or even sit up long enough to finish a plate of food. Dr. Emily Brigham, a pulmonologist, notes that as COPD worsens, patients often rely on family members or caregivers to feed them, which can be emotionally distressing. Patients may feel ashamed or frustrated that something as simple as eating has become impossible without help. Dehydration is another serious concern. Because many COPD patients struggle with thick mucus production and chronic coughing, they often avoid drinking fluids out of fear that it will worsen their congestion. This leads to dry mouth, difficulty swallowing, and increased fatigue, making it even harder to maintain strength. Dr. Susan Black also explains in one of her lessons that many families and patients are unaware of how quickly malnutrition can worsen a COPD patient's condition. Weight loss leads to muscle deterioration, which weakens the diaphragm and chest muscles, making it even harder to breathe. This triggers a vicious cycle where poor nutrition accelerates respiratory failure, ultimately shortening the patient's life. The emotional toll of nutritional struggles can be just as distressing as the physical effects. Many patients mourn the loss of their ability to enjoy food, something that once brought them comfort and joy. Some refuse to eat out of frustration, while others feel guilty watching their loved ones desperately try to feed them. Hospice nurse Laura Martinez also spoke about these issues in one of her educational discussions on the subject. According to her, a patient named Mrs. Franklin became emotional when she could no longer enjoy meals with her grandchildren. She had always been the one to cook for her family, and when she could no longer eat, she felt like a burden instead of the strong, independent woman she once was. She once whispered to her nurse, "I feel like I'm disappearing." The combination of breathlessness, exhaustion, bloating, nausea, and lack of appetite makes nutritional challenges one of the most difficult and heartbreaking experiences for COPD patients nearing the end of life. Caring for a loved one with end-stage COPD can be emotionally and physically challenging. However, understanding the progression of the disease and knowing what to expect can help ease some of the fear and uncertainty. Hospice care plays a vital role in ensuring comfort, dignity, and support for both patients and their families during this difficult time. If you found this information helpful, please consider subscribing to stay informed about important topics related to end-of-life care. Don't forget to like this video and share it with others who may benefit from this knowledge. Your support helps spread awareness and provides comfort to those who need it most. Thank you for watching.